Did I ever think that I'd be doing Zoom patient visits? I thought nothing short of a pandemic would cause that, but here we are.
3 weeks ago, you could not reach a patient on the phone and communicate and have a legitimate ethical visit. Well, you can now. Love him or hate him, Trump said this is equal to a face-to-face visit. This. Because we needed people to see people.
So what happened is the government sat back and said, we've got patients that need to have immediate access to their physicians. So we're going to relax those requirements and we're going to allow for conversations to be happening over the public channels. Ones that you and I and our children and others have been using for a long time, known as either Google Duo or FaceTime, or some of the other products that are currently available online for us to communicate with families overseas, for example.
Of course, telehealth really was a thing before COVID-19, seen in rural areas like Mississippi in this public TV report before the pandemic, when HIPAA rules required more expensive communications technology. Dr. William MORRONE has been pushing for more telehealth while practicing addiction medicine across Michigan's thumb.
Now we're looking at it happening everywhere. And it just 3-4 weeks ago, right?
Right. And it should be happening everywhere because, Jesus, Mary and Joseph, it's 2020. We've been hearing about telemedicine for 40 years.
That we had to literally shift our entire way of doing business unexpectedly and within about 4 days.
In Detroit, the Children's Center's mental health services pretty much all now delivered by telehealth.
So we had initially thought that we would decrease the number of people coming to our campus. And then we had a meeting with our executive leadership team, and it was decided, we think it's in everyone's best interest to just figure out how to do our job remotely.
Okay, so you hurt your elbow.
Michigan State University Healthcare quickly turned to telehealth. In East Lansing, they're finding new ways not to see patients in person.
We went from, in sports medicine, we didn't have telehealth at all. It wasn't on our radar at all. And then within 7 days, it was live. And so we've had to adjust the way we interact with patients, adjust the way that we perform visits. It seems silly, but for me, looking at joints and how people interact and move is still very important. And so we have people at home that I'll have a spouse hold the computer while they walk around or while they move their knee or move their shoulder, so we can still deliver the best quality care that we've always delivered, but just in a fashion that enables the patient to remain safe.
Detroit area psychiatrist Terry Vigor sees an opportunity with seniors.
It doesn't seem to be a big deal as long as they have a cell phone. The rate limiting factor is, do they have a cell phone? And then number two, if they do have a cell phone, do they have unlimited or enough data to be able to use the platform?
Dr. Vigor has started using the Doximity app with her patients.
Or search for a phone list near you.
She calls it Facebook for Physicians. Seniors with just landlines can't use it, so she started a non-profit, hoping to raise money to buy them smartphones. It's all about ease of use.
And then at the bottom, if you can see, all I do is tap video call or phone call. The patient gets a phone call, like an ordinary phone call, and then they'll see something to touch, that says I give permission, and that's it. That's all there is to it.
Then there's another component of telehealth that's easier, getting the money.
Limited reimbursement results in limited access. And so that was I believe the biggest changes. The technology was always there. And so now the fact that it's paid and paid by their insurance, it makes it more viable.
And what's happened is suddenly physicians are getting paid for the time that they are providing. If you and I are having a 15-20 minute conversation, in the past, a physician would not be compensated for having that type of encounter. And yet they should be, because there is medical decision making that is occurring. Up until 3 weeks ago, there was no payment for that. Now there is.
And are you worried that this may not continue after this COVID-19 crisis subsides?
I think that they will see the advance of technology saved lives and money.
Studies of telehealth's
When they do their
effectiveness,
studies-
they'll come in time,
So,
but Detroit
directly
area
some of
healthcare
our
provider
officers
Eva
and medical
Metashevsky has a plea for Lansing regulators now.
The request of the governor of the state of Michigan, please don't go ahead and pull things back. The healthcare community has to realize we are going to be experiencing severe PTSD. We will not have enough behavioral health folks to be able to meet the needs of those individuals that will be struggling with mental health issues. So it's extremely important for us to not only maintain, but perhaps enhance what it is that we currently are doing in the way of telehealth.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.